Hello everybody, this is the Planet Earth here. I'm having a really bad anxiety attack. Now for the people that have been telling me not to lay down while having an anxiety attack, this is actually the most comfortable position for me when having one. It actually is the most comfortable position. This one's really bad. My heart is going really fast. I gotta take an Ativan. Oh. The green light helps. I don't know why, but it does. It's my comfort zone, I suppose. So, right now, the feelings that I am feeling is a rapid pulse, a bit of shallow breathing, palpitations. I usually get palpitations only during anxiety attacks. Other than that, my heart is very stable. And feeling of impending doom, such as if I'm gonna die or not. I've been trying my best to not focus on the actual rapid pulse, but when I'm having an anxiety attack, I force myself to breathe normally, but it's so hard because your body wants to breathe extra, and when you're breathing extra, it doesn't seem to make things worse. It does not, actually. But I get lightheaded and almost pass out. I've checked on my vitamin levels, and I have checked my thyroid and other conditions. I don't have any other problems. The only thing I have is MTHFR, which is a folic acid issue. And my right ear causes me balance issues too, so that makes it more difficult to control anxiety attacks. Because for some reason when I'm having an anxiety attack, I become off balance. Not every panic attack and anxiety attack covers. I am fighting right now to talk normally. So far I'm doing good. Get up and walk, and that's not that easy. I actually had an anxiety attack in a couple days. It's been about a week, I would say, since a really bad one. Sweating. Thoughts of death are coming in my head, am I gonna die or not? I can still move my hands. My face is numb. I mean, my mouth is actually cotton ball right now. My mouth is drier than the desert of freaking I need to take an Ativan. I was sleeping, by the way. It's 2:42 a.m. I was fucking sleeping. Excuse me. $30, 69, 100. $160 beats per minute. They need to find a cure for this shit, dude. At least the bed smells good. It's nice and fresh. God, it's like somebody's fucking holding a gun to your head and fucking gonna fire and nothing's happening. Oh no. Oh god, I hate this part of the anxiety. Oh, I hate this part. I'm dizzy. Damn it. Get over here. Stupid fan. I have kicked and punched you and you're still good to me. Finally broke it? God damn it. Really? I hate these! My heart is racing so fast right now. Where's the stupid health application? I can't even read. It's all blurry right now. I'm not even joking. When I have anxiety attacks, where's the stupid S health? Oh, there it is. Won't measure it. Won't measure it, dude. Samsung. Won't measure it because it's going too fucking fast. Oh, I've tried everything. I've tried everything to stop these and these won't stop. I've tried everything, every fucking anti-fucking over-the-counter fucking acupuncture, kava or whatever the heck it's called. I've tried freaking, what was it, HTTP or whatever the hell it is, HTP or whatever the hell it's called. I've tried freaking vitamin D, C, A, K, you name it, I've tried it. Potassium, magnesium, I've tried it all and it doesn't work. I'm having trouble breathing right now. I don't like this. I don't like it. If I can talk, I can breathe. Why won't you measure, you stupid bitch? It won't measure it. Not while I'm having an anxiety attack. Oh. Dear Lord, please help everybody else on this planet. Please help them all. Please help everybody else on this planet. We're only human and you make us suffer so badly. Why do you make us suffer so badly? We don't do anything to you. But we only have this own planet to work with. Ooh. Ooh. I'm having chest pain. Oh, there comes the acid. Ooh. Skip. Oh shit, it skipped 3 times. Oh, that's scary. Oh, that is scary. Skip. Okay, it's back to normal. Oh, that is scary. Oh no, that's not gonna help my anxiety attack. That's not gonna help it. Alright, dear Lord, please forgive me of all my sins. If I die, that's fine. I don't want to die though, but just take me wherever you gotta take me. But like I said, I don't care. Just cure this anxiety thing. Whatever we humans have, please. Oh my god, my pulse is going. Ooh, I can feel it in my head now. That's high blood pressure. I don't have high blood pressure. It only happens during these type of events. Oh yeah, ooh, it's real high right now. Oh my god. Oh no. My pulse is really fast still. Wow, this is a long anxiety attack. I haven't had a pulse like this in a while. And I haven't taken anything that would aggravate it. Nothing. Nothing's been. I haven't drank anything except for water and that's it. Oh, my post is going so fast. Oh, it's 2:53 a.m. Marina Del Rey. Current temperature is focus on the screen. Although it's blurry, focus on it. It's 59 Fahrenheit. Well, let's see what Google says. What is the current temperature in Marina Del Rey?
Degrees in Marina Del Rey right now.
What is the current temperature in Marina Del Rey?
It's 59 degrees in Marina Del Rey right now.
What is the current temperature in San Antonio, Texas?
It's 65 degrees in San Antonio right now.
What is the current temperature in Lower Manhattan?
It's 17 degrees in New York right now.
What is the current temperature in Baghdad, Iraq?
It's 52 degrees in Baghdad right now.
Focus. What is the current temperature in Sydney, Australia?
It's 73 degrees in Sydney right now.
What is the current temperature in Billings, Montana?
It's 28 degrees in Billings right now.
What is the current temperature in Saskatchewan, Canada?
It's minus 15 degrees in Saskatoon right now.
What is the current temperature in Alaska?
It's 31 degrees in Anchorage right now.
What is the current temperature in Tokyo, Japan?
It's 45 degrees in Tokyo, Japan right now.
That seems comfortable. What is the current temperature in... No. What is the current temperature in Antarctica? Why does the pulse go so fast during an anxiety attack? What is a human?
Human, if relating to or characteristic of people or human beings.
A 180 beats per minute. Fuck. Fuck. I might have to call. Fuck, dude. Oh my god. This is terrible. I'm hitting them. I'm hitting about 43 beats per 15 seconds. Times that by 4. 16. It's about 180 beats per minute. Shit, dude. Shit. I'm not making myself worse by doing this. I'm concerned now. I don't have a pulse. I don't usually get this high. The Lord is my shepherd, saying. I'll just read it. I just read it. I know this will sound strange, but it helps. The Lord is my shepherd, I lack nothing. The Lord is my shepherd, I have all that I need. Exactly. Now it feels like it's going over 200 beats per minute right now. Oh my god. Uh, wow. Poor heart. No. Oh, I'm itchy everywhere. Jesus. What the hell, dude? I'm just trying to remain calm. Just try to remain calm, Ben. Man, I can't believe how fast my pulse is going. It's hitting almost 200 beats per minute now. I know it sounds stupid to check your pulse, but when it's going above 200 beats, it's getting a little serious. 44. 44 times 4. 4, 8, 12, 16, 70, almost 190 beats per minute. Not quite 200 now. I'm starting to feel something though. It's actually a good sign. But my fucking pulse is fucking flying like a bitch. I'm not low on potassium. I'm not low on calcium. I don't have heart disease. I don't have a rhythm disorder. This fucking sucks, dude. This fucking sucks so fucking bad, dude. This fucking sucks. I don't feel. I feel very hot right now, like extremely hot. But I don't have a fever though. I do not have a fever, but I feel hot as hell, dude. Jesus, I'm like a fucking vent, like a fucking heater going off. Well, that's just because my heart rate's going high, stupid. Oh, I'm so close to wanting to call the paramedics right now. It's because my heart is going so fast. I haven't had a pulse this high in a long time. Don't check, don't check. Give it about a couple minutes. Give it a fucking couple minutes. Give it a fucking couple minutes, dude. That event should be kicking in soon. Okay, this is a really bad anxiety attack. My pulse is going so fast. I'm actually very vertigo right now. Actually, my left eye is blurry, and my right eye is blurry. They're both blurry. My vision is actually blurry. I've never had this problem before, and I have a chest pain too. I still want to call the paramedics. You don't usually want to call them, but this is an extreme case of fast pulse. You'll be fine, Ben. You've had these before, though. You just haven't had one this intense in a long time. I'm not necessarily feeling a lot of emotions right now. Just the fear that I'm dying. I'm getting freaking facial numbness. And my pulse is really, really high. And it's actually sounds like fapping, but it's not. It's actually going like this. Going faster than that. It's like oh, it's going. I can give you the pulse here. My pulse is going down now. It's about 160. I can feel my pulse by putting my hand over my heart. That's how fast it's going. $158. Always times it by 4 every 15 seconds. You get a rough estimate of how fast your heart's going. I am fighting this so hard. I'm trying not to cry like a little girl, but this fucking sucks, dude. Fucking pulses of 200 beats per minute. It's like fucking fully exerting yourself without exerting yourself. It's like dying without dying. It's fucking terrible. I don't know why it happens. And it fucking sucks, dude. I'm still feeling numb. Not quite as numb, though. $147 beats per minute. I can catch my breath again. Yep. Yes, I feel that. Just chest pain. Okay, anything else, Ben? Ow! Oh, I just gave myself tinnitus. Tinnitus. Oh. There it goes. Oh, now I'm seeing stars. I am seeing those stars, boy. What's up? I am seeing the stars. Yeah, I literally gave myself tinnitus. I gave myself tinnitus. How strange. I'm starting to feel calmness now. Okay, I'm starting to feel calm. Oh my god, now I'm breaking out in sweat. That's a good sign. That is always a good sign when I break out into sweat. Ugh, I'm all lubricated. Yep, definitely. That's always a good sign when I break into sweat. $28 beats per minute. Wait, no, 28 beats per 15 seconds. Oh, that's going way down now. Ooh, I'm starting to feel it kicking now. I was in dead sleep, I had no dreams, and then suddenly I just woke up to a full-fledged anxiety attack. That's so weird. How many more lifetimes am I gonna have to suffer from this anyways? Everybody that suffers from anxiety and attacks. Why do we have to suffer for this anyways? I'm just curious, like, why? Is there a specific reason? I mean, like, what did we do at birth to deserve this? You know, like, what did we do at childhood? What did we do so badly that we had to suffer from this? Well, that's what I want to know. What the hell did we do to deserve this? This, whatever the hell it is, whatever whatever it is. No matter how much stuff you have, if you have an anxiety attack, it doesn't fucking matter. It's 3 o'clock in the morning. .22 beats per minute. 88 beats a minute right now. Good. Oh, I can't even cry. I'm fucking fucked up, dude. I'm so fucked up. I can't even cry, man. My emotions are gone with my anxiety disorder. I mean, I want to cry, but it's just too fucking much, dude. It's just too fucking much. What the fuck is wrong with us? What is wrong with us as humans? Why do we have this fucking code of certain people who suffer from anxiety? I want to find a cure for everybody on this planet. You don't understand what it feels like. I'm a fucking 20, almost going on 24 years old. And we suffer from this anxiety thing. But why? I was having a good sleep. I was having a good sleep, man. All of a sudden you just wake up in fucking fear of death. It's fucking dark in the room. And you feel like you're gonna fucking die. I can't even cry, man. I'm fucking broke up, dude. I'm fucking broke up, though. I'm tired of it. No fucking reason whatsoever, man. It just happens. .78 beats per minute. If there's any doctors out there in this whole world and you're watching this video to learn off of it, please don't let your patients suffer. Give them what they need to stop the anxiety. If you have to give them benzodiazepines to calm them down, prescribe it to them. The risk associated with benzodiazepines are abuse. The risks associated with continuous benzodiazepine is short-term memory loss. The risk goes up when you take more of the medication. I have recommendations on benzo switching to keep up with the benzodiazepine tolerance, and I'm going to recommend it to anybody watching this video that has just seen an anxiety attack or has had one. I recommend that you guys switch benzos every year or so, because once the other benzo starts to work on you very well, or doesn't, then the other benzo that you were previously taking and you were having a good time taking with will be just as strong as when you first took it again. You kind of have to switch benzodiazepines. You don't have to take more than the recommended doses that your doctor prescribes you, but you have to take a different benzo for a while, at least 2 or 3 months, and then you can get back on the other benzo and have no problems. You won't have anxiety switching from Ativan to Klonopin, aka clonazepam, and Ativan is aka lorazepam in the United States. Um, they also have a thing called Xanax. I don't like Xanax, aka a Prolozam. That's the United States equivalent. I recommend benzo switching if you're taking benzos for an extended period of time, like I have. But for some reason, the Ativan that I take works just fine. I don't know why, but it does. I suffer randomly. I suffer randomly like this. Every other day, and maybe once a week, it depends on the week. It could be every day of the week. It could be 3 times. It could be 2 times. It could be 4 times. Or 5 times a week. Other weeks I have none. But when it happens for no reason. It's unprovoked terror. You don't understand. When my pulse was going that fast, I thought I was going to die. And it's scary having a pulse that fast. I have other recommendations. Tell your doctor to give you a benzodiazepine. I don't really recommend it, but, it's like a medical disease. Like, say you have low iron, you need to take iron supplements. Yes, they're non-addictive. However, taking too much can hurt you. But taking benzos too much can hurt you. Now, you medically need to take the iron. Mentally and medically, you're having an anxiety attack every other day, every week, every month. And you have generalized anxiety. So why won't the doctors just prescribe that for anxiety? If they know that can help people with anxiety disorders, they should prescribe it. Because it just ain't fair for people to suffer. Nobody should have to suffer from this attack that we get in our brains. It's released of adrenaline. The adrenaline is released into the bloodstream, and the fight or flight response kicks in abnormally. And that's why we have these extreme heart rates. Maybe some people with chest pain or palpitations. It's because there's a lot of adrenaline released into the system from the brain suddenly. And your endorphin levels actually drop, and the adrenaline takes over, and you go into animal mode. Inappropriately, of course. Instead of somebody breaking into your home, your brain is breaking into your body. And it's so weird, because no one else is panicking. You're panicking like crazy. I don't really panic. I get so much anxiety I think I'm going to die, so I just stay still. This is what happens during an anxiety attack. Why won't people listen? Why won't people listen to us? Why? What did we do wrong to deserve something so fucking evil? And it happens every week for some people. It happens every day for some people. It happens multiple times a day. Stuff like this happens every single day to people around the world, and nobody without anxiety disorders understands how scary it is. Without anxiety disorders, you are lucky to live in a body that does not have anxiety. You are very lucky, and you should thank your fucking stars, because with people with anxiety, this is exactly what it feels like. You can't really explain it until you have one yourself. It's like having a arrhythmia problem. Think of you having a sudden arrhythmia problem and you're on the ground. It's similar to it, except you can breathe somewhat. It's like having a sudden a V-fib without the V-fib. You're your heart's out of whack suddenly. That's what it's almost similar to. What, it's not the same thing, but it's similar feelings that you might get going into VFib. It's similar, but it's not the actual death. I don't know what to tell you people. I don't know what to tell you, I don't... Would you go back over here? Thank you. I don't know what to tell you people with the anxiety disorders. I don't know what to tell you people. All I know to tell you is this has to end. There has to be an end. I thought I was going to die this morning. And no, walking during an anxiety attack does not help me. Sometimes it does, sometimes it doesn't, depending on where I'm at. Oh, the Ativan's kicking in. Doctors, prescribe the motherfuckers Ativan if they need it. Prescribe them Xanax if they need it. If they are complaining about constant anxiety, give them the fucking medication. Stop beating around the bush. If people are having fucking anxiety, give it to them. Let them calm down. If you think they're abusing it, switch them to a different benzo that is stronger. I am telling you, at least 70 to 80% of the people that come into a psychologist's office are not abusing these drugs. They are taking them because they actually are suffering from anxiety. I've met people in Los Angeles now who suffer from anxiety like I do. Especially social anxiety. Agoraphobia. Social phobia. I've seen it. I have a little bit of social phobia. It's very minor though. It's subconscious too. It's weird though, cause like I don't get scared going into stores. I just get anxious for no reason going into a store. Some people have phobias, so those phobias cause anxiety. God, the Ativan's kicking in now. I'm itchy again. Oh fuck, that feels good. But anyways, like I said, please. Doctors of this whole planet, if you are listening in and you are keyed into this channel and this YouTube video, please find a fucking cure. Okay, it has to start with MTHFR. It starts there. Okay? The folic acid not hitting into the brain barrier. We already know that might be causing the anxiety disorders. Fix the issue, please. There has to be a way to alter the brain without antidepressant medications or antipsychotic, psychotropic drugs. You don't need psychotropic drugs like freaking Haldol or Thorazine to sedate your patients. You don't need freaking Benadryl. You don't need Benadryl. You don't need Vistrol. Give them something they can actually relax on. Please, I just had an anxiety attack. I'm trying to tell you while just having it. Doctors, if you are listening, if there are any patients listening, send the video to your doctor. Do something. Stop. Don't sit there and suffer anymore, please. Don't suffer anymore. Don't suffer what it feels like to be short of breath, what it feels like to have an extremely high pulse rate for no reason, what extremes it feels like to be vertigoed out, and experiencing unsteadiness and dizziness. Please, guys, we need to end this anxiety disorder for everybody on this planet, and I am being very dead serious right now. Please find the fucking cure. I don't want to go through this for the rest of my life. I have tried it. Guys, you can recommend things all day long, and those spammers can recommend their sites all day long, but they never work. I know it's in my mind to change the anxiety, but it's physical. It's not mental. If it's releasing adrenaline, it's physical. Don't you guys think that's physical? Medical problem? Medical? Maybe too much adrenaline's being released? Maybe too much of the stress hormones being released? We gotta fix that. The only known temporary cure for anxiety is actually exercising to the point where you can't exercise anymore, where you're so freaking tired of, obviously your body's drained of adrenaline. In an emergency though, your body will make more immediate adrenaline, I'm sure of it. But in a non-emergency situation, your body will be so tired, you can't have anxiety. You will not have anxiety when you're tired. It's only when you're normal. Please, please find the fucking cure. Please find the fucking cure. I'm begging. Just a cure, a something. Something. Give them the benzos. If they want the benzos, give them the benzos, okay? It's like people... we need the medication to live normally. To live normally like you do, doctors. Like, you guys have nice cars. You guys take thousands and thousands and thousands and thousands of dollars from all those people who suffer from disorders of mental illness, schizophrenia, bipolar, anxiety, depression, multiple personality disorder, psychosis. Okay, you guys can take tens of thousands of dollars when you sign up from these contracts from other companies of antidepressants, so you can make a little extra money by giving them the real medication that works, which are benzos. Give them the real medications that work, and get off your high horse and care for your patients. Go look at the medical dictionary, please. Go look at the doctor's book, okay? Read the doctor's book and read what it says about the patients and how you're supposed to take care of them no matter what. What is their best interest? Do you want a patient who is suffering every day? Do you want them to go to the psychiatric unit? Do you want them to suffer from anxiety for the rest of their lives? Or do you want to help them and get them on the right path? And so they could say, thank you, doctor, for helping me so much. Because that's all we really want. We just really want somebody to help us. We want somebody to be there. We want somebody to know what it feels like to suffer from this. We want somebody to know what it feels like to suffer from the anxiety that we have every day. Every day. We just want somebody to figure it out. That's all. There's 7.8 billion people on the planet. There's gotta be at least one who knows the cure. It's so scary. It's so scary to have a pulse rate that high. It's so scary. It's so scary. I feel for all the people with depression and anxiety. I feel for them. I really do. I treat people with disrespect and I don't mean it. And then I'm having panic attacks and anxiety attacks. I don't know what the fuck to do. I don't mean to treat people meanly if I do. I don't mean it.